Good evening. It is uh, it's October the 29th, is it?
Yeah.
Okay, October 29th, 2021. I am Kalia Anna Young Kelly, and I am 38 years old. Um, I'm married. I have two children, two sons. I finished college, and I have a degree in business communications. I also hold a certificate in nail technology, a nail technician, um, and also have a degree in liberal arts. And at one point, I have a year of my master's under my belt. That's a whole nother topic. But I am a start off. I am a child of God, and I believe that Jesus is the Savior. And I want to say that I am telling my story because I am been under His grace and mercy. I have SLE Lupus, um, which is the type of lupus that um, affects my joints, my muscles, certain organs in my body, um, and even inside, outside, skin, brain, all of that. I am in a hospital room. I just had surgery yesterday. Lupus. Gotta wait. It started loving on some of my organs in my stomach and my intestines, and the latter parts of my body. This will have been. Let me say this. I don't have a specific number yet, but I've had at least one surgery for the last 14 to 15 years. And this year alone, I've been in this hospital three times. Once, the first time was the my second baby. He's 7 months old. Before he was born, I had a blood plug that came out, and my husband had to rush me to the hospital. I was about 8 months pregnant, and we had to come in, and they had to figure out what to do with that and stop that and prevent him from coming too early. Um, and also, the baby had calcium in his body, and he had a dilated stomach, which means he had holes in his stomach. So we were praying and being strong for this little baby, and he was being strong with us, fighting. He was fighting for his life, and I was fighting for mine. And mind you, all of this is going on. We are about 12, 13 months into COVID. The second time was when he was delivered. His name is David Emmanuel Kelly. I went into labor on March 9th. Ironically, that was the day that he was supposed to be. I was scheduled for a C-section, but David decided to have other plans, and he came earlier in the morning, and I had ended up having a vaginal delivery. My first son, I went in thinking that I was going to have a vaginal delivery, and he had God had other plans, so he ended up becoming my first C-section. So from that point, I just was always told in the assumption that I would continue to have C-sections if I have any more children. Um, that pregnancy, this last pregnancy, helped me to understand, and my doctors understand, that you can have pain beyond the pain scale, which is 0 being the lowest and 10 being the worst. And I say that to say, if anybody's watching and you've been pregnant or you know someone has been pregnant, when you go into labor, the highest that I always assumed or understood was that you go from 0 centimeters to 10 centimeters. Within a couple of hours, came in the hospital at about 8 or 9 centimeters, and getting ready to deliver, I was over 10 centimeters, 10 plus. It's a very scary feeling. Through the grace of God and the team that was around me, my husband, the doctors, the nurses, helped me conquer the biggest fear in my life was to give birth vaginal. And before all this, I've had several surgeries on my stomach just alone inside. It's just been crazy. He came out well and healthy. Um, the hole in his stomach healed, and the calcium was still present, but it wasn't affecting him. And to this day, he's doing well. He eats, he drinks, he burps, he poops, he plays. He's actually trying to stand up right now and walk, and he's trying to form words or some type of communication to us. We call him our little nugget because when I was told when I was pregnant, he was 3 months already. I was 3 months pregnant already. And when we had the ultrasound, we can see his little hands and his face, and he was like waving at us to let us know, I'm here. I've always been here. I'm just waiting on you guys to recognize I'm here. And he looked like a little nugget of gold. Um, the third time was where I'm here now to um, have the go in and it's hard to explain or to even say. One of my ovaries, my left ovary, was dilated. And what that means, the ovary was twisted like a telephone cord, swirly, and they couldn't see it on an x-ray or MRI. He actually had to see it for himself when he went in to have surgery. I also suffer from with endometriosis, which is scar tissue on my cervix, scar tissue on inside my buttocks, scar tissue, pelvis, everywhere. I've had two endometriosis surgeries. I'm saying this so crazy. This particular doctor did my second one, and then now he just did the partial hysterectomy. I'm telling this story because I know someone needs to hear this, and they're probably going through it in some way, or know someone that is going through it. And I've always wanted to be an advocate for myself and then advocate for others. But before I can be an advocate for others, I understand that I had to advocate for myself. I have been diagnosed with lupus it's been 16 years. I was diagnosed when I was 21 years old. And if anybody's watching this, if you're in 20s or you're my age or older, you know what that feels like when you're 21. You feel invincible. You just barely legal. You can go to clubs without being carded. You can go to the liquor store and get liquor. No one, you get the car. You're at that point you are grown, and you can make decisions for yourself, and you can do what you in your mind think you can do anything. And I did feel that way. I also felt something was not right eternally with my health. I started seeing a lot of floaters in my eyes, my shoulders, my legs would hurt to the point where it was I'm in a fetal position. I'm crying because it hurts so bad, and not and a Tylenol or a BC powder at the time I was taking a lot of those just didn't do the trick, and it wasn't enough. Um, I had been on and off of steroids for a few years. And when I was in middle school and high school, I was misdiagnosed with asthma. And what came about with that is because I would constantly have sinus infections and viral infections, and there'll be one sinus infection, then a bacterial infection, and a viral infection. Which is essential is if you have SLE lupus, it's systemically grabbing on one thing, one organ, or one body part at a time, and it's just constantly going from, it's a war within, the your joints, and it's a war within your muscle, it's a war within your sinuses, it's a war within your brain, and the cells, the white cells and the red cells are constantly fighting. And so your body is constantly at war. And when you're at pain, you're not getting any peace. You want to go to sleep, you want to rest because you're tired, but your body's in so much pain you can't even rest. Sometimes you can't even think or form your own sentence. Um, I was diagnosed March of 2004. I was between being a freshman and sophomore in college. I was just trying to get my life back on track. I had been in school for about 3 years, 2.5, 3 years in college. I transferred to another college because I failed my I failed the second year of my freshman year of college. So yeah, that was a whole big thing there. Trying to do too much. Trying to go to college and then going to nail school in the evenings. And I was just doing too much in my life. Um, and not balancing and not trying to balance, trying to do everything at once. My body just kept shutting down and kept fighting me, and it was just pain and pain and pain. And so what I would do with that pain is I would take the over counter medicines, and then I would eat to comfort me, um, so I can get rid of that pain, and then to keep moving and keep working. Finally, my body just said, I can't do this anymore. I can't do this. The first time I actually was aware or made aware that I possibly had lupus was when I was 15 years old in high school, and I was a sophomore. School had just relatively started. I think it was around September, October. I was in pre-AP classes. I was the school's mascot. I was really just coming into me, and I got a bacterial infection, and then the bacterial infection went to a sinus infection, and then from there it went to a mono. Have you ever heard of mono? So it's called the kissing disease. I didn't even have a boyfriend at the time, and my main focus was school and just on school and getting my work done. So I didn't even entertain um, male friends or whatever. Um, my pediatrician at the time told my mom and I treated her for all these different infections, and then I also did additional blood work, and the levels in her body are showing that she has lupus, SLE lupus at the time. I remember my mom just like gasping, like, "Oh my God!" And I'm looking at her like, "Okay." um, at the time, we only knew one person in our family who had it, and that was my mom's first cousin. She's younger than her, and my mom had was able to see her live with this from being a young girl, and then I think she was in her early 20s, where she had to just stop everything in life, and she had these bouts where she couldn't get out of bed and sick and stuff. So she's seen a lot of it. I had little peeks and glimpses of her, but I did for the most part understood that this thing called lupus was really bad on this lady, my cousin, and then I had a teacher in seventh grade. She had lupus, and I've seen her go through her crisis, but I really didn't. I didn't really have a grasp on what that was. I understood that this is not something nobody wants to have. The pain, the debilitation. You don't see them for months or weeks or whatever. They're doing fine, and all of a sudden now they're sick, hospital sick. Um, and so back to me being 15, the pediatrician said, I I can't fully diagnose her because she's a minor, and with the medicines that they offer at the time, minors could not take it. So I just had to endure all of that for 7 years. Um, from 15 to 21. I go back and my mom said, I told her, I'm not feeling well. I don't feel right. And I remember she was telling me, yeah, your skin looks really ashy, a little dark. Um, I wasn't sleeping well. And my eyes was just bothering me. I kept seeing all these floaters. I felt like I was just kind of almost losing sight. And I go to the normal ophthalmologist that my parents always been taking me since I was 5. And they said, no, you need to go to your PCP. Okay, I'm going to remind you all, I'm 21. I don't understand pediatrician, PCP doctor, and all his specialties, and I don't get it. My parents understood or took care of all those insurance and questions and things. So I'm thrust into it. I had to learn quickly. Crash course. I go back to this pediatrician. At this time, the first pediatrician that said that, I could possibly have lupus, he had left the practice. So I was with another guy. And I had been seeing him off and on for a couple of years, like the latter part of high school and right into college. And I go in, I asked for a physical, an annual physical, and I told them the symptoms I was having. My shoulders, my left shoulder would constantly hurt, to the point I would have to put slings and things on my arm just to keep the mobility from moving too much, and to try to get the pressure, the relief, give me some relief. I went in, I believe it was a Monday, Tuesday, to have the physical, and that's EKG and X-ray and blood work. They called me, I believe it was a Thursday, and said, we need you to come back. We're seeing some things on your lab. My mom was like, doesn't sound too good, because if it if it was everything was okay, then they wouldn't have called me that soon. So apparently they see something. To this day, I don't know what my mom thought it could have been. I don't even remember what I thought whatever the diagnosis could have been. Um, I can remember my feeling of the relief. Finally, somebody can give me a name to this stuff, because it just it's not making sense. I'm good. I'm moving around a couple of days a week, and then all of a sudden, the next day, I can't get out of bed. I need a whole nap. I need medicine. I am just in excruciating pain.